I think there is some connection issues. We'll just get back once Dr. Suruchi is able to join us. Just give us 2 minutes. There's some technical glitch. Please stay tuned while I'm getting Dr. Suruchi this side. Hello, ladies and gentlemen. A very good evening. I am your host and host, Nisha Kaushal from Team Nutrizoe. Hope you all are well settled with your tea and ready for an amazing session with our own expert, Dr. Suruchi Desai. So we are just waiting for Dr. Suruchi to join us live. Give us a few more minutes and then we'll start. It's unable to join. Just few more minutes, Manas. Just stay tuned with us. There's some technical glitch that is going on and Dr. Suruchi is not able to join. Ma'am, Dr. Suruchi, I have sent you a request to join me on live. Please check your message box. Guys, there is some. So mothers, please stay tuned with us. We'll be live in another 5 minutes. I'm just waiting for Dr. Suruchi to join us. So we are just waiting Dr. Suruchi to join us. and there's some technical glitch at her end or maybe at Nutrizoe end that she's not able to join.
Hi,
Yes. Hi, ma'am. Good evening.
good evening. I shall
Yes.
just get let me get my video. Just a
Sure,
minute.
ma'am.
There is too much rain this side, so we are having a little bit of network connectivity.
It's
Just give
it's
me a
all
minute.
over Mumbai, ma'am.
Yes.
So by the time ma'am is getting ready, I would again like to say a very good evening to all the mommies who have joined us. I am your host and host Nisha Ghoshal from Team Nutrizoe. I hope with all this Mumbai rain going on, as we are ready with our chai and pakoras, all our mothers are also ready with their chai pakoras to have an amazing session with our own Dr. Suruchi Desai.
Hmm. Yeah.
Yes.
Is this okay? No, I
So,
can't
Dr.
see much.
Suruchi, she is a senior op gynecologist for Nanavati Hospital with an expertise of high risk cases, ovarian cyst, adolescent gynecologist, and menopause. She is the first doctor to deliver COVID positive mother in a private hospital. So far, she has treated 35 pregnant patients and delivered 21. Wow, ma'am. That's really amazing. So, moving forward with the topic of today, what to expect when you are expecting. So, I'm sure most of the mothers can resonate with this topic. I wish I had attended any such topic when I was pregnant at that time. But with not taking much of your time, let us all listen to what Dr. Desai has to share with us about what to expect when we are expecting. Over to you, ma'am.
Hi Nisha, a very good evening and thanks for the lovely introduction. Welcome to all the mommies who are waiting to expecting and the ones who have just delivered. Let's start with making this rainy day a little brighter and not so gloomy.
Yes.
What to expect when you're expecting? So, human body is a Pandora's box. Medicine doesn't follow logic or mathematics. 2 plus 2 can be anything but 4, especially when you are obstetrician. We need to understand that a lady can pop out 5 babies, and there are unfortunate ones who can never deliver in spite of all the medical aids and all the medical facilities available. So, I think the best way to prepare yourself is just go with the flow. Read up a lot, but that just doesn't mean that you have to put into practice everything you read. Ultimately, it's your gynecologist who will be your best friend, your those for those 9 months whom you have to trust, because at the end of the day, it's your gynec's job to give you a healthy baby and make sure the gynec doesn't compromise with the health of the to be mom. So I think whenever patients ask me, doctor, is it something stressful or kuch डरने जैसी बात है? I said I should be the one worried first because you are coming to me with so much faith. And if I can't deliver what I'm supposed to be doing, then there is a failure at my end. So it is extremely important to stay cool. Yes, reading definitely helps a lot, but you need to understand that you just cannot go by the books. There is no blanket therapy for any pregnant woman. Today, here we are in urban cities and we have the pleasure and we are lucky enough to have an Insta Live. But in the same breath, I'll say in rural India, there are women who don't even see a doctor and they still deliver. They have home deliveries, they have deliveries by dyes. That is not, whether it is right or wrong is not what I'm trying to tell. But what I'm trying to tell is that there is best of both the worlds. Ignorance is bliss at times, but at times staying ignorant can cause a lot of health issues. So we need to find that fine little balance and try and walk on that line and maintain our balance. It's like we're walking on the tight rope and trying to, Just make sure that we don't fall on the either side of ignorance or excess knowledge. Too much Google knowledge is completely dangerous for you, your unborn child, and your doctor finds it difficult to treat. I can treat pregnancy, I can treat medical disorders in pregnancy, but I can't treat Google. I can't treat the Google symptoms. So that is something we as women should understand, that in the past our grannies and great grannies had 12, 14, 15 children. And if you ask, I remember asking my grandmother, my paternal grandmother, how many kids you had, and she would just think and maybe scratch her head. Oh, was it six? No, no, so six are alive and then one passed away after 1 month, or was it 3 months? And I think two, three times I must have miscarried also. So they, they just took it. They did not challenge a lot of things. Okay,
Yes,
and
ma'am.
they had lots of children. So if they kind of lost a baby, it was okay with them. They had still money more to love. Today, we just have one or two. And the modern obstetrics believes and follows the rule that you cannot lose a single mother or child in the process of delivery. The
Yes, ma'am.
healthcare of a country rep- shows how forward and how well the country is equipped medically. Till about few years ago, where our maternal mortality rate was high, it was more than 2, and we came into third world countries. If our healthcare system improves, which it has improved lovely over last 10 years, we are dropping the number of mothers we lose during the process of childbirth and the neonatal mortality rate. And that reflects that we are trying to do some good work and reaching, penetrating even in interiors of the country.
Yes, ma'am.
Secondly, Nisha, what one thing I really want to mention when I'm saying that we need to be positive about, not get anxious about childbirth and how it will happen and when it will happen. नॉर्मल होगा, सीजर होगा, वो तो सिर्फ ऊपर वाले को पता है. हम लोग ने एस्ट्रोलॉजी तो पढ़ा नहीं है, सिर्फ ऑब्स्टेटिक्स ही पढ़ा है, तो मैं
Right.
तो नहीं बता सकती. The same way, when it comes to lactation, I'm sure you guys would be knowing there is so much phobia, there is so much fear around lactation. We had a teacher who taught us in medical college, and the only thing she always told was, भगवान ने बच्चे को सिर्फ सक करके सिखा रहा है, सक करके कैसे करना है वो सिखा के भेजा है, और lactation is no rocket science. It is the bond with the child which will help and enhance lactation. But because of a lot of medical diseases, lot of stress, today we are finding these problems, failure of lactation, latching, delayed lactation. That's when all the other things come into help. But it's a very natural and a physiological process. Let's not mess with it,
Very true, ma'am.
right?
Very true. So, well, ma'am, I must say it was a insight, like listening all these things, that apart from Google, also there is a world, and
Absolutely.
we should,
Absolutely.
but we should not blindly follow all that. We should always
Right.
listen to our gynecologists. We should listen to our doctors, and we should definitely ask our doctors. We should always ask for
Absolutely.
help rather than just going, Googling, and getting our own answers.
What I've not understood, Nisha, is when you buy an AC or a car and there is a problem, you go to the mechanic says, रेडियन में पानी कम है, कूलेंट कम है, ऑयल कम है. आप गूगल करते हो? नहीं. जो वो बोलता है वो करते हो आप.
Correct.
शायद वो जरूरी नहीं था, फिर भी आप करते हो बिकॉज वो एक मशीन है, यू डोंट वांट टू टेक चांसेस विद दैट मशीन. देन व्हाई डू यू वांट टू टेक चांस विद योर ओन बॉडी?
Very true,
How
ma'am.
can you not trust a doctor? Because, like I said, it is my job to make sure you have a safe delivery. So, am I going to falter in my job?
Yes, ma'am. Very true. Very true. So, as we have both pregnant and delivered moms reaching out to us, I think we have a list full of questions coming from them. So, let me take you
Let's
through.
start it.
Yes, ma'am. As usual, the first question coming up is how to calculate the expected date of delivery.
Right. So basically, it is 9 months plus 7 days from your last menstrual period, provided you had a 28 or a 30-day regular cycle. If your cycles were irregular, like 40, 45 days, then it's going to be very difficult to kind of just calculate it. We go by the sonographic date. But otherwise, there is something called as Negley's rule, what we follow 9 months plus 7 days. Mind you, we say it is 9 months, but it is 40 weeks of pregnancy, 40 weeks of gestation. The first 3 months, mid 3 months, and last 3 months. The first 3 months, typically by maths, would be 12. 3 months is 12 weeks, but it is 13 weeks. Coming back to the same thing. Obstetrics doesn't follow mathematics. 2 plus 2 can be anything but 4. So the first trimester, mid trimester, and last trimester, each trimester is 13 weeks, and the last trimester is 39. That comes to 39 weeks plus 7 days more. So the third trimester would be about 14 weeks.
Coming up with the next question, is it normal to have a little spotting during the first trimester?
So generally, the way pregnancy is, the lining of the uterus, what we call as the endometrial lining, that is where the egg, the fertilized egg goes and implants. If this is your lining, it sticks there. And it gets nourishment or nutrition from that lining. And that's when a lady misses her period and she comes to know she's pregnant. Very rarely there are cases wherein every month during her period dates, the lady may have a little spotting, a brownish discharge. I've had patients who've had these kind of bleeding till about 5 months of pregnancy.
Oh,
Okay. So once we know that it's a cyclical pattern and happens during her expected date of menses, it's okay. But otherwise, uh, it could mean there is some infection. It could mean there is some internal bleeding and may require some hormonal support. Very rarely, it could also mean that the pregnancy is not healthy and is heading towards an abortion. So instead of self medicating and Googling your symptoms, wiser to just go and meet your gynac once. The gynac would definitely do an ultrasound to confirm what the cause is and treat it accordingly.
yes. So the every answer comes to a final. Please go back to your doctors. Don't Google.
Absolutely, absolutely,
Move
absolutely.
on to the next question, ma'am. What should we eat and what should we not eat during pregnancy?
So this is a question I think we all face as a gynac every time the patient comes in, and we have a Indian mindset wherein food is everything. We don't believe in exercises. We just believe in putting everything inside.
Eating for two.
So yeah, there is nothing like eating for two because ultimately you have to lose weight for the two that you have put on, right? And you have to carry the weight yourself. So there is absolutely the only contraindication that I would say is any all these genetically modified foods and the foods which are very high on MSG, that is your Ajinomoto. So a lot of Chinese food, a lot of pre-packed processed food, the ready to eat ones. So I tell my patients just go through the ingredients if you're buying a off-the-shelf product, and if it says that it's unfit for women and it's unfit for a child under 12 months of age or infant under 12 months, then the pregnant lady should avoid it. Many a times there is a lot of misconception about how to eat the dry fruits and which fruits to avoid. So generally, papaya and pineapple, scientifically, they don't have uh, any of those things which you cannot kind of uh, eat. But the thing is, there papaya and pineapple have a little bit of bromelain and papain enzymes, which can cause a little bit of cramping in stomach. And if there is some issue like a spotting or something, then we are worried about it. So technically, it is your chemically laden foods which you should completely avoid. Your Ajinomoto, your Chinese foods, a lot of salty foods. Yeah, that is something we should avoid.
So there is a
So your
mother.
papads, pickles, achar, go low on it.
We'll go low on it.
Yes, yes,
So there
yes,
is this
yes.
mother, ma'am Rupali. She is asking at which week premature delivery can happen, which will not affect baby. I'm
I'm
sorry.
sorry I lost you. Can you just come back?
Yeah, sure, ma'am. So we have a mother with us, Rupali. She is asking
Yeah.
at which week premature delivery can happen, which will not affect the baby's growth.
Darling, 9 months is why the baby needs to be in the incubation in the uterus, because that's when. So the first 3 months are organogenesis, wherein there is the growth from a fertilized mass of, from the egg and the sperm fertilizing and forming a ball of mass. The decision of which will be the head end, which will be the foot end of the baby, and those limb buds and everything happens. So technically, after about 32 weeks, formation of the baby is kind of completely done. And then it is maturation of all the systems, especially the lungs that we are looking at. We, I have delivered triplets as young as 27 weeks, and they've all survived. In fact, they are 7 now. They are the youngest triplets, one of the youngest triplets of India. But they would require a neonatal intensive care unit, the NICU care. Some babies may require a lot of physiotherapy for their muscular development. Some may be on ventilator because of the lungs not being matured. So the best is after 36 weeks, they are safer to be born. Between 32 to 36 weeks, we are worried more about the lung maturity. Anytime after 25 weeks, overall growth of the baby is affected. So they would be really teeny weeny and would require a lot of NIC.
I lost a few seconds. Yeah. So moving on to the next question. Exactly what is gestational diabetes and what is the main thing that a mother should be taking care of?
So any diabetes which comes up in the mother after 20 weeks of pregnancy is called gestational diabetes. So sometimes there are women who are already high on sugars, borderline high on sugars, preconception, but the ones which are picked up or they were normal preconception or in the first trimester, first 3 months, and after 20 weeks when the sugars go up,
Mm-hmm.
it's called gestational diabetes. So there are a couple of tests which your doctor would advise you of: fasting blood sugar, post-lunch blood sugar, also something called as the oral glucose tolerance test, OGTT, wherein you are made to drink a glucose water, and then your blood sugars are checked at 1 hour, 2 hours kind of stuff, or directly after 2 hours. There are different ways to do the test. So once that comes positive, depending on what range your sugars are, is when we are supposed to take care. Obviously, the first thing is go low on your sugars. Indians love to have the tea and coffee laden with sugars. It's like a sugary syrup. That's where your indirect sugars go in, and your breads and your biscuits. So these are the things which I always tell my patients to stop first or reduce first. Cut the bakery product because they have a lot of refined flour and sugars. uh, Eat healthy carbohydrates so they are not directly glycemic, high in glycemic index, and will cause sudden rise of sugars. And definitely diet, not just plain diet control, but exercise, walking would be mandatory unless you've been asked not to do so because of any other health issues during pregnancy.
So I can so much relate with this thing, ma'am, because I delivered my second one with high gestational diabetes, and
Oh my
I
God.
was throughout with the doctors, and like every hour I have to SMS and send. So definitely, I can bet that please don't go on the Google. Trust your doctors with that,
Yes,
because
yes, absolutely.
they handled my case very beautifully, and
That's nice.
after delivery I'm all over with that diabetes stuff because I again went to a doctor and they guided me. So definitely.
Perfect. Perfect. Yes.
Moving on to the next one, the favorite one is it safe to exercise and work out during pregnancy?
Okay. So now I've had these wonderful patients who have never walked even 5 minutes would want to run a marathon in pregnancy. I have, I have no idea why everybody wants to start in pregnancy only. प्रेगनेंसी में एकदम हॉट दिखना है, प्रेगनेंसी में ही सब कुछ करना है, प्रेगनेंसी में स्विमिंग सीखना है. I mean, all these years you didn't do anything. Now suddenly why? So just because you're going to be active doesn't ensure that you are going to have a normal delivery. Okay? You have to be physically active throughout. Number one, we need to understand that as we grew older and once we hit the puberty, the pelvis is fixed. Once your height was, you stopped growing, your pelvic bone is a fixed bone now. If this is the shape of your pelvic bone, if this is your shape, the head has to pass through this. So your bone shape is not going to change. Yes, your muscles will become more compliant, you will be able to handle labor pains better, right? So being active throughout the pregnancy is extremely important. It could mean simple walks to it could mean घर का काम झाड़ू पोंछा लगाना, whatever it is. Don't start something new and end up damaging yourself more, number one. And secondly, most important thing is if you've had bleeding in pregnancies and if you have other issues, there is a probability that you might not be, allowed to do a lot of strenuous exercise by your doctor. So that again would depend if you're allowed to exercise, simple walks, jogs. We've had athletes who get pregnant and they continue their training under medical supervision. So there is no restriction, but starting something absolutely new which you've never done, I think is going to be a little difficult.
So we have a mother named Afreen Khan. She's asking, does a baby's growth depend on what a mother eats?
Yes, absolutely. Absolutely. So if you're not going to be eating a lot of healthy food stuff, you're going to be only eating junk food, then the nutrition going to the baby is not going to be great. Poor diet have shown, and we have medical studies which says that the babies can be low birth weight, they can be tiny. We have to understand baby is a parasite. Baby will pick up everything which the mother is going to give the baby, right? So if you're not going to be healthy, you will end up not having a healthy pregnancy. The moment the baby is born, your system may collapse in the sense you may have excessive bleeding, you can have failure of lactation, you can have delayed lactation, you can have a lot of infections because your immunity is low. So eating a healthy diet is definitely important. Whether pregnant or not, we always know that, right?
Yes, ma'am.
Yeah.
Okay, moving on to the next question. Do we need to cut down on coffee? Caffeine
So
bad?
these are the, sorry.
Is caffeine bad during the pregnancy?
So it depends on what kind of, how much of caffeine is what you're consuming. So typically, we have Indians have their tea and coffee a lot with milk, right? So that is not so bad. But if you're a hardcore black coffee drinker, yes, then just one glass a day or one cup a day is acceptable. But if it's a coffee with, it's like milk with a dash of coffee, then it's okay. You can consume, you can enjoy your coffee.
Moving on to the next one, ma'am. Is it safe to get vaccinated for COVID during pregnancy?
Ah, no. So during pregnancy, we very clearly know that the government ICMR guidelines and the MOH, Ministry of Health, Government of India, have given a clear statement that during pregnancy, please do not get yourself vaccinated because we do not have enough data on the same, and hence we do not want a pregnant lady to get vaccinated. But once you have delivered, you are in the lactational period, you are breastfeeding your child, it is safe to get vaccinated. Whichever vaccine is available, you could take that.
So coming on, ma'am, one more is what all vaccines are to be taken during pregnancy? There are some vaccine which needs to go in a mother's body during
Yes,
pregnancy.
yes, yes, yes. So very simple. We know that tetanus toxoid is something which we always give. Yeah. Once you are about finished your 3 months, you're given 2 shots of tetanus toxoid during your 9 months of pregnancy. If you've just delivered a year or year and a half ago, then maybe just one dose is enough to cover up in the next pregnancy. Nowadays, the uh, FOXI guidelines, that is the Obstetric and Gynec Societies of India guidelines, say that two more vaccines which we would want a pregnant lady to take in the course of their pregnancy is one is a Boostrix or a Tdap vaccine, which has tetanus, diphtheria, and which covers tetanus, diphtheria, and pertussis. So something like the DPT that we give our babies at 6 weeks, we would want our mothers to take a lesser dose of the same after 32 weeks of pregnancy so as to protect the child from a whooping cough or a strong irritating cough after birth in the newborns. And in cases of flu season, which is like how we have right now, the rains have set in and there'll be a lot of fevers which would be happening. So a flu vaccine also is recommended during pregnancy.
So moving on to the next one, ma'am, how to reduce foot swelling.
Right. So basically, there are a couple of reasons why you would get that. A is because you've generally put on weight, so the whole weight comes onto your ankle. Secondly, you are doing a lot of job while standing, like typically women who are cooking, the homemakers who are doing all the chores standing, right? Thirdly, it could be the beginning of your blood pressure, which is showing that, oh, there is swelling happening, the ankle edema happening. Fourth, it's a wrong footwear. You are wearing very tight footwear. During pregnancy, we need to kind of change our footwear, which we may not have done that. And that is why you are getting the swelling. So, A is make sure that you are not kind of standing for a long hours. And if your job does involve standing for long hours, take breaks. If you're sitting, you do work from home, or you're in the office, put your feet on a small stool on the opposite side where you are sitting. So that would really help a lot. Don't keep your limbs hanging. Keep them a little at a elevation. At night, you could just put a small pillow underneath your legs, and that would help you reduce the swelling. Again, check for your blood pressure. If it's on the higher side, go low on your salt intake and make sure you're eating enough and good proteins because lack of proteins also would give rise to swelling.
So there is a mother. She's asking. She has fibroid. Does it affect the
Yes.
growth of a baby?
So depends on where the fibroid is, the location of the fibroid in the pregnancy. So it's within the uterus, outside the uterus, in the muscle mass of the uterus. And sometimes the fibroid and the baby both are very closely lying with, in their uterus itself is a compact organ. And the fibroid grows in pregnancy for up to 3 to 4 months, then it may be static. And then again, with the hormonal changes, 7th, 8th month onwards, it may grow. So sometimes the fibroid and the baby have to compete for space, and that could give rise to constricted space for the baby to grow. Can give if the fibroid location is such that the baby may not be in the head down position, maybe in an oblique position or a buttock down position. And very rarely the fibroids can give rise to pain and spotting or bleeding during pregnancy.
So, ma'am, again, the same thing that we are talking about. So, is there any parameter or any fixed number to say that how much weight should their mom expect to gain during the pregnancy?
So, our textbooks would tell us the law of 10. So,
Mm-hmm.
the law of 10 says it's 9 months plus 7 days, so 10 months of pregnancy. Make sure the hemoglobin is 10, 10 hours of rest, 10 kg of weight gain.
Wow,
So,
ma'am, that was
bare minimum, yeah. So, 10, if you remember the law of 10, I think that's more than enough. You
right.
will not really kind of go and put a lot of weight. By and large, we've seen women putting between 10 to 12 kgs. Yes, we've had patients who put on 15 to 20 kgs also. So then it becomes difficult. The more weight you are carrying, it gets a little more difficult to be mobilizing yourself. You can get a lot of medical comorbidities because of that.
So, ma'am, as the current scenario is going on, COVID everywhere around, so of course that stress thing is in everyone's life. But wants to
Ah,
how does the stress affects a pregnancy?
any kind of stress. If there was no COVID, there was a stress whether I'll get maternity leave, whether my husband will be there during my labor. My boss is giving me a lot of stress. How will I manage? So
Right.
stress is a part of life, right? We know Mahabharat says, and Mahabharat has, it's written in Mahabharat that Arjun's mother went, Abhimanyu's mother slept off, and that's how Abhimanyu couldn't get out of the, Bhul-bhulaiya.
Yes.
So the thoughts that you have, the food that you eat, the songs that you listen to, or the movies or the TV that you see, that all those emotions are transmitted to your child. I have seen in a practice of 20 years that when a mother is super anxious, the child inevitably is a very colicky baby, it's very colicky. And there is no reason why you can pinpoint why the baby is a little more crankier. So if we are going to be worrying about tomorrow and not going to enjoy our present and future both are going to be in a mess. So
Right.
stress is something we should keep it at length.
Right, ma'am. So moving on to our next question, doctor. It is how will I know that the baby is coming and it's time for me to go to the hospital?
So, well, it could either be bleeding which is started, or your water bag has suddenly burst and you're completely drenched and wet. It just continuously, it doesn't feel like you peeing, but you're sitting and you're just wet in a pool of water. The water would be clear like a tap water. There could be pains, your pains like your period pains, which would start from the back to the front, from the back side to the front to the abdomen coming in. It could, you can feel your uterus getting tight and then relaxing and tight and relaxing. So these are the most of the signs or symptoms that you would know, and the pain gradually would keep on increasing in intensity and frequency, and you have to reach the hospital.
So, ma'am, this was for normal deliveries. Like, if a mother is going to do a C-section, what are those that she needs to look after if that's an emergency and she needs to rush?
So right. So see, as the emergency C-section would be either there is decreased fetal movements or the fetal movements are just not perceived and the heart rate is reduced. So once she reaches the hospital, she'll come to know there's some emergency, sudden headaches, vomiting, blurring of vision. These are the signs that it's an impending BP going up and down, and that could be fatal for mother and child both. Sudden weight gain in the period of 2 to 3 days, you really feel that you put on weight. There is sudden onset of swelling on your feet, on your hands. Movements which were very rhythmic and regular are suddenly reduced, or you just can't feel them. These are the things these are your red flags, I would say, that you need to go to the hospital, and then the doctor would decide how to deliver you.
Okay, so moving on to the next question. What pregnancy symptoms are normal and what's an emergency?
So as long as your baby is kicking inside healthy, I mean the movements are well felt, you don't have any pains, you don't have any bleeding, any excessive discharge, foul smelling discharge, curdy white discharge, which could mean there's some infection. I think these are all normal signs of continuation of pregnancy. Like I said, the first red flag is if your baby is not moving enough, there is decreased fetal movements. Please, 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 please go to the hospital. Many a times we have lost those babies because neighbor ne bola, ruko, abhi to time hai. XYZ ने बोला जाने की जरूरत नहीं है, and we've ended up having disasters. I always tell my patient one extra visit to the hospital or to the doctor is not going to cause trouble to anybody, but one less visit, it could be disastrous.
So, ma'am, when we are talking about the baby movements, what is the like? How much count exactly should a baby move in a day, in a 24?
Right. So generally, we would start monitoring these movements only after about 32 weeks in the eighth month.
Right.
So typically after each meal, that is your breakfast, your lunch, and your dinner, within an hour you should feel about five movements. Yeah, or about 20 to 25 movements in the whole day. If that is the case, then the baby is moving fine. Everything seems to be fine. But in case after your breakfast, lunch, or dinner, either of the times you felt less than five movements in an hour, you just felt two or three movements, they were very sluggish, then time to go to the hospital.
To go to the hospital. Yes, ma'am. Moving on to the next question. I am in my third semester. What should I do now to prepare for breastfeeding?
Yeah, so basically, we always, the gynec, all of us, most of us, especially female gynec, we would check your breasts for seeing if the nipples are flat or if they are, inverted nipples. How is the overall development of the breast? Massaging in the eighth month, like just cleaning the nipples after bath. There is a lot of dead skin which happens. So just making sure that that all is cleansed. You can just apply some oil after a shower and rub the nipples with a towel to remove the dead skin. That is basically, so in case if the nipple is flat, inverted, or covered with a lot of debris, it's taken care of. Otherwise, eating healthy and good intake of calcium is extremely important for milk lactation once you deliver. I think these things are more than enough, and not getting anxious whether I'll be able to feed my baby. That's very important because you will be able to feed your baby. I mean, why shouldn't you be able to feed your baby? Very rarely we see that there is a strong family history that the mother, the grandmother could not breastfeed. So it's a genetic thing wherein there is a failure to lactation or delayed lactation or inadequate lactation, wherein then we'll have to supplement the newborn with top feeds. We can't let the newborns be hungry, right?
Yes.
So I think you just need to be positive, and I think things will just go fine.
Okay, so moving on to the next question. I have a positive home pregnancy test. Am I pregnant?
Yeah. So you are pregnant. How healthy the pregnancy is, we only check up or the hormones checked in the blood, the beta HCG will tell us. But uh, once there is fertilization and the pregnancy grows, the beta HCG, the hormone of pregnancy, starts rising in the blood. Once it reaches more than 100, it is picked up by the urinary pregnancy kit, the home pregnancy test kits that we do. So, yes, you are pregnant. Only thing, we might have to do a couple of blood tests to see that it's a growing, healthy intrauterine pregnancy. Or maybe you might have to kind of go to the doctor and they would advise a sonography to just confirm that it's in the uterus and nowhere outside the uterus. But a positive test means you are pregnant.
Okay. So, mothers, if you have any question, please keep adding your questions in the comment box. We'll take all your questions. Moving on to the next one. Uh, how to deal morning sickness? Ah, that's a bad
Yeah.
one, ma'am. When you get pregnant, morning sickness is a very bad.
Yeah. So, as a gynac, we are sadist, because the morning sickness tells me, okay, your pregnancy is growing fine because your hormones are good. So, I'm happy about it. When you're in labor, you complain of pain. I'm happy. Okay, you're getting good contractions. So, you should deliver. So, morning sickness is, in a way, a good positive sign that it's a healthy pregnancy. Typically, there are women who say that my morning sickness reduced or completely stopped, and we stumble upon a miscarriage. So, the extra hormones which are growing can make you feel a little nauseous because it irritates your stomach lining, the gastric mucosa, right? So, the way to handle this is eat small, frequent meals, eat every 2 hourly. You can have a lot of bland foods like your small bananas, cheese slice, khari biscuits. They are the ones which are bland foods that could help you take care, handle the nausea. You could suck on some avla supari, some churan. In dry fruits, you have jad aloo or the aloo bukhara. Sucking onto that helps you decrease your morning sickness. Typically, Indians have this habit. The morning they get up, they brush their teeth, and then they just have a tea, coffee. Some liquid is the first thing that they put inside the system. So very rarely what happens, or many of the times I would say it happens that since you are hungry, you've eaten your dinner at 9:30, 10, and the next meal or breakfast is happening at 8 a.m. or 9 a.m. So it's about 10 to 12 hours that you are hungry, your stomach is empty. So there is a lot of acid secretion. So the moment you brush your teeth and you start puking and you start feeling nauseous and belching and all that khatte dakar aate hai. So brush your teeth and eat something first. So it could just be one biscuit, a small banana, some dry fruits. Let the acid get settled down and then have your cup of tea, coffee, milk, whatever you want.
Ma'am, next one coming up is, can I fly during pregnancy?
Uh, First 3 months, absolutely no travel, whatever it is.
First
There
three.
is no travel. Yes, first 3 months till we are sure that the pregnancy is growing absolutely fine. We are not going to be traveling. After that, depending on where is the placental site, whether the placenta is low lying, whether the mouth of the uterus is fine, it is shorter, whatever, depending, your doctor will allow you to give you permission to fly.
Always ask
But
your doctor.
the yes, so it is safer to fly maybe between 14, 15 weeks to 30 weeks, not after that or not before that.
Ma'am, moving on to the next question. It is, if what are the signs of early falls and real labor?
Early.
Early falls and real labor.
Okay. How do you differentiate between the false labor pains and true labor pains? Okay. So typically a false labor pain would happen anytime after 36, 37 weeks. There could be intermittent contractions, they would subside. Many a times constipation can give rise to labor pains. I would say it is false labor pains. So you go to the doctor, maybe they give you an enema or they give you some laxative, you empty your bowels and your pain subsides. A real labor pain would keep on increasing in intensity and frequency, and the duration between two pain episodes would start becoming shorter and shorter. So that is how it is. If you could get a contraction now and the second one after 40 minutes and the third one after 1 hour, definitely it's not labor pain.
So moving on to our next and the last question for tonight.
Yes, yes.
A pregnant lady needs to change her beauty routine. Like,
The pregnancy itself makes her look so beautiful and makes her glow. Why does she want to change anything? Yes, you can go to your massages, you can go to your spas. Right now, everything is shut, but I'm sure in the post COVID era, we'll be living normally. So, what we need to understand, don't use any new cosmetics which you have not used before, because we really don't know. If you develop an allergy to something, there's very little we'll be able to help you with. Whether it's a hair color, whether it is uh, hair straightening or those treatments for your hair, or whether there is a facial, whether bleach, whatever you've done before pregnancy, you could continue doing that. Regarding massages, you could have a manicure pedicure. Do not do any massages which have a lot of acupressure points involved. We wouldn't recommend you to do those things. And otherwise, she could continue using the same uh, soaps and body washes. Many a times, in pregnancy, what happens is there's a lot of oil secretions and they have a lot of acne, and pigmentation in pregnancy is very natural, especially in the last trimester. In the eighth and the ninth month, your skin starts becoming a little darker, underarms become very dark, your neck becomes pretty dark. So these are hormonal changes which would revert back within 3 months post delivery. But yes, if it's really disturbing, you could do a bleach, bleach your skin. Anything locally should not be a problem unless you develop some rash or reaction to it. Yeah. And many a times women keep on saying that we have a lot of these apple cider vinegar the first thing in the morning and some honey with water in the morning. So those things are okay. Apple cider vinegar is something we would advise to avoid because it causes a lot of acidity and gastritis. That is something I would say just avoid in pregnancy. Rest you could continue your routine and enjoy and pamper yourself.
So, well, I'm so touched with this beautiful face that I would like to share this with all the mommies who have asked this question or who are really bothered about their beauty. You are pregnant and you're powerful. You're bold and you're beautiful. Please
Absolutely.
go forward in your boldness and in your beauty. And trust me, you're just fabulous.
Yes, absolutely. You're creating a masterpiece. So you are going to do a good job and you're doing it beautifully. So don't get anxious. Enjoy your pregnancy. Uh, Eat whatever you can and whatever you allowed to. I have splurged on pizzas and ice creams in my pregnancy, which I never otherwise would have even thought of. I'm not an ice cream person, but with my second one, I used to be craving for ice cream. Then I used to just sit with the tub and enjoy. As long as my gynae told me that as long as you don't fall sick, you don't get a sore throat and come back to me, you can safely eat what you want to eat. So I think everything in moderation should be the clue, should be the key rather. And it's a beautiful journey of 9 months. Just enjoy every bit of it.
Very true, ma'am. So, all the mommies who are listening to us, who have joined us, and who have just gone through this, what to expect when you are expecting. Of you, Nutrizoe has a giveaway contest for the bestseller, What to Expect When You're Expecting, and even though for the first year moms. So do follow us, our Instagram page at the rate Nutrizoe, and register yourself on our website www.nutrizoe.com. It's been a complete honor, Dr. Surichi, to have you and interact on behalf of so many moms. A session like this in such timings are really helpful. Thank you so much for taking out your time from your extremely tight schedule. I know I've been following you from last a week almost and you on and off. Thank you so much, ma'am, for your time and being a
Thank
part of
you.
our next Nutrizo Expert series.
Thank you so much. Have a wonderful evening and
Yes.
stay safe. Thank you.
Ma'am. Thank you all the lovely mommies for joining us today
Yes.
session. Do join us for an extremely important session coming up on 19th June, 5:30 p.m. with our next expert. Good night. Take care. Bye, ma'am.
Thanks. Good night. Have a safe night. Thank
Yes.
you.